So a lot of people want to know, what is the best nicotine replacement therapy for them?
There's lots of different kinds of nicotine replacement products on the market, and as far as we can tell, there's not a lot to choose between them in terms of their overall effectiveness. So it's more a question of what kind of a nicotine product a given smoker actually gets on with. I think it really is important to stress that I would definitely use a patch plus one of the other forms of product, because the patch gives you a steady dose of nicotine over the day and deals with the nicotine hunger quite well, but it doesn't deal so well with the sort of situational cravings, the ones that get cued by particular situations. So in terms of the other products, things like the gum have been around for an awful long time. If you're using the gum, I would probably use 4 milligram gum rather than 2 milligram. The 2 milligram gum's probably going to be a little weak, but see how it goes. Lozenges give nicotine at a similar sort of rate, and some people prefer them. Again, I'd probably start with a 4 milligram lozenge rather than the 2 milligram. People worry about how much nicotine they're going to get from these products and think that they're going to overdose on nicotine. If you do start to overdose on nicotine, you'll just start to feel a bit sick, and then you can reduce the amount you take. It's not going to do you any permanent harm. So it's much better to make sure you've got enough nicotine in the system and start with enough nicotine, and then you can always reduce it later on. So we've got the gum, we've got the lozenge. One of the ones that I think is particularly good for very heavy dependent smokers is the nasal spray. This is a spray that you just squirt up your nose, and the nose has what they call a leaky membrane, which means that it actually absorbs things through it rather well, and that makes it quite good for absorbing particular kinds of drugs, and that's true for nicotine. So the nasal spray, you just put a squirt up each nostril. To begin with, it'll make your eyes water. It's pretty irritant, but what we find is actually that people get used to it pretty quickly. So that's another one to consider. There's a mouth spray as well, which is pretty good. There's a dissolvable strip that you just dissolves on the tongue. There's a sublingual tablet. One that's different from all the others is the electronic cigarette. We've got far less data on electronic cigarettes than we have on all the other products, but the evidence so far is that they clearly do help quite a lot of people stop smoking. There's various different kinds of products. The ones that I think seem to be most helpful are what we call the tank models. These are ones with refillable cartridges, and you can actually decide what kind of nicotine concentration you want, what kind of flavors you want, and so on. And that actually makes the whole thing a lot more palatable. You can even decide with the heating element that creates the vapor what voltage you want, and so on. So you can actually tailor it much more to what your needs are. And I think we're going to see, well, we are already seeing more and more people using electronic cigarettes as a way of getting off smoking. Some people who do that will carry on and use the electronic cigarette, maybe indefinitely, maybe just for a few months or years, and some people will just use them just like nicotine replacement product. They'll use them for, I don't know, 3 or 4 months, and then they'll come off those.